Something come in before you did this?
Before I did
I
this,
don't really like.
I decided to come, now I know I need it.
And I can
Oh,
drink
my
two of
God.
those a day, so I take Pepsi. My
And my stinking
granddaughter,
sister
well,
was
not
supposed to
granddaughter,
come
my
with me.
niece.
Oh no, it's
This
too
is
cold.
clean.
Oh, I felt like that. Haven't been out
On
This is the first time you've
diets,
been out?
and the diets
since
for
Sunday.
the way to eat, to
Well,
heal
Monday
your
was
stuff.
the best.
Hello, everybody.
Yeah,
Thank you all
well,
for coming out. I know it's cold, but I appreciate you coming out and enduring the elements to get out here. I hope you enjoy and learn a little bit about what we're gonna talk about. Low back pain and sciatica, last 30 days, who's had any low back pain, sciatica stuff?
all over the.
Okay, yeah, everybody, myself included. I'm not only the president, but I'm also a member, so they said. So I want to get right into it. I'll try not to talk too much, too terribly long. It's something I'm passionate about, so I can get the rambling and so forth. So if I chase the squirrel too far, just corral me back in. The sheets that everybody got, one of the yellow sheets. So I'm going to try to just kind of go through that format and try to answer the questions as we go along. If I skip something, hurt me back. We'll get back to it. But first, I want to talk a little bit about what low back pain and sciatica is. Low back pain, we know what that is. The pain there in the low back. But sciatica is a weird word that somebody made up once upon a time that honestly doesn't mean a whole lot. So, and I'm not an artist, so forgive the attempt. So, if we look at my rendering here of the spine, we've got the pelvis right here. So when we talk about low back pain, what we're really talking about is this central pain that we get just right in the middle, that business right there. Fairly straightforward. But when we talk about sciatica, depending on where you're at in the country, for some people, it means this area just right here. And a lot of us get that. I get that. So what we're looking at, the pelvis on either side of the tailbone or the sacrum. And so a lot of times we consider that to be sciatica, but more often than not when we talk about sciatica, we're talking about this pain that runs down the leg, either down the back or over to the side, under the hip. Sometimes it'll come around to the front. And so more often than not, that's what we're talking about when we say sciatica. For our purposes, I'm going to refer to either radiating pain or sciatica pain. So it really depends on where we are. But the key is figuring out why you're having pain and where that pain is coming from. Imaging, we'll talk about this. Imaging is important, but you have to be careful with imaging because it can be misleading. The best doctor in the world will tell you that imaging is nice, but we treat the patient, we don't treat the image. So we have to be cautious of what we're looking at there. So that very first question, let me redo this guy here. Come back up. And boom. So sciatica, sciatic nerve. So the sciatic nerve comes from, it runs down the back of the leg, but it comes from the fourth, fifth lower vertebra in the spine, and then 3 down in the tailbone or in the sacrum. And then they run all the way down the leg. At the knee, they split. One runs off to the side and comes to the top of the foot, and the other branch comes all the way down into the heel. So the sciatic nerve is the longest and largest nerve in the body, and we do have one on either side. So given where it runs here, on 1A, it's the largest and longest nerve in the body. On B, your body does have 2 sciatic nerves, obviously one on either side. On C, sciatic nerve travels from the back, down the back of the leg, and into the foot. So sciatica sufferers may experience pain, numbness, or tingling in the leg, and it's caused by a problem in the back. So I like this to be interactive, so I'm gonna get everybody, if you will, we're gonna stand up, we're gonna do some movement. If you've had falls and so forth and don't wanna risk it, understand. But let's everybody get up. We're gonna do 4 little things. All right, first thing, I want you to just reach down
Can't do that.
toward the toes and then come right back up. And who has a problem with that? I know mine's a little tight when I do that. Okay? What about hands on the hips and then leaning back? That'll usually get a little bit more. I usually hear a little bit more groaning. Any problem with that?
Yes, a little bit.
A little bit? Okay. Okay, and then let's look at side to side. Anybody with any particular issue there? A little bit there, and a little there. All right, so y'all can sit back down. I was just kind of curious to see who's got what going on. Honestly, I didn't hear as many moans and groans as I usually hear, so y'all must be doing pretty well. Okay. So who am I and why am I up here talking about this? I graduated from PT school in '94, so a little over 25 years ago. I was fortunate, and I'm from here in Texas. I was fortunate to be in a school that had a really good emerging orthopedic program through a group that was here, based out of an organization through Europe. Now I'm Texas born and bred. I'm proud of my Texas heritage, but the U.S. and Texas, we're a little bit behind the times when it comes to things that we could do clinically as clinicians. We've over the intervening 25 years, we've caught up, and so we're doing a lot better in that regard. But I was fortunate to be trained by a lot of really good people early on. So as I started working with patients, I felt like I had some good results. I had some not so good results. At a minimum, hey, everybody was exercising, they were doing stuff, and it was good. But that really wasn't enough. I wanted to see more. So I decided to pursue my doctoral degree. So I went through getting my doctorate in physical therapy. And that was great, and I'd love to tell you that was why I became good at what I do and why I know what I know, but that's not true. I enjoyed working with those studies, and I'll be honest. Partly, it was because I've been in private practice this whole time, and partly, selfishly, I didn't want some 22-year-old snot-nose coming out of school and being a doctor and me not. So partly it was that. I mean, just to be completely honest. But I did learn a good bit. But it's still, I wasn't learning enough. I wasn't finding the good answers that I was looking for dealing with pain and problems. My mother is 78, and she's been dealing with back issues and neck issues her whole life. And she was, like many of my patients, dealing with a lot of pain and business out here, and I just really could never come up with a good solution to take care of that. And so I went and I got some more advanced training through some top-notch clinicians, both here in the U.S. and then abroad, and learned a lot about spinal manipulation. Got certified in that. Again, didn't get me as far as I wanted to be, so I looked even further, and it had just become in vogue, if you will, in the U.S., the concept of dry needling. Well, I thought that was a bunch of hooey, because, well, it's just because I did. So I went ahead, got some training in that, more as a joke than anything. Took what I learned there, brought it back, and started using it clinically, and found that gave me some of the best results of anything that I've used. So I went on, I got training in 2 different schools of philosophy in dry needling, one based more on the acupuncture side, one based on just European dry needling. And so, started using what they taught me, and I was really impressed, and I'm still impressed with what we learned there. But still, I didn't feel like it went far enough. And so, over the past 7 years or so, I developed my own approach through things that I've learned, both through my coursework and then things that I've seen on thousands and thousands of people. And I developed what I feel like is the best approach to dealing with musculoskeletal issues with dry needling. Went to the U.S. Patent Office, got it trademarked, and I teach throughout Texas on that approach. Matter of fact, we've got another course coming up this weekend down in San Antonio. So I was going to bring my manual out. I just finished one of them today. So I've got the book is about 360 pages. I mean, there's a lot of information. I think I came up to, what was that number? 724
something like that.
different ways that we can use the needle throughout the body to elicit the change. And we'll talk a little bit about why I use that so frequently. So I say the word, so that's who I am, and that's where I've become and what I do. Now, all of that aside, the spinal manipulation, the dry needling, the joint mobilization, all the hands-on work, all of that is good stuff, but it doesn't mean anything if we can't restore movement and function into this machine. The machine that we have is the best piece of engineering that's ever been created, and unfortunately it wears out, and so we have to figure out a way to fix that and keep it moving and keep doing what it needs to be. Every now and then I'll have I've had people in their mid-90s come in and they can still palm the floor and they can do all of these things, and they're just genetic marvels at how they can still function. Then I have 24-year-olds come in who are a mess. And so regardless of where we are in that spectrum, the use of what we do here clinically is about getting pain under control, getting those issues manageable, so that then we can get that body moving back to how it's supposed to, how it's designed to. So I chased that squirrel a little bit. All right. So so when we talk about back pain, sciatica, and honestly any pain really, and I can't write either. The question is this a constant pain? Or is it a pain that's reproducible? So, who has problems standing while they're standing with their back? Anybody? Okay, walking? So,
Obviously.
right. So things when we're standing, while we're walking, bending, lifting,
Yeah.
okay? Lifting, and we were doing a little bit earlier, vacuuming, doing the laundry, the dishes, any of these things that brings us over.
Yeah.
Weed eater, that's a big one. For some people, jogging. But the key that these all have together is we can reproduce these. We can do that activity. So whether we're bending down, whether we're leaning back, side to side, those can all be reproduced. What we get concerned about, and honestly, what frequently there's nothing that I can do about, is when we're dealing with a constant pain. That usually tells us there's something else, something deeper going on that really needs to be looked at. But the nice thing, if you call it that, if it's reproducible, then we can also make it reducible. So if we can find what's making it happen, we can reverse that. Again, we're not gonna change the fact that things are wearing out, but if we can make the machine work better, then we can change that. Yes, ma'am?
What if you're just sitting there and, I mean, I have been sitting there not moving or doing anything, and all of a sudden I get this grabbing pain in my,
So we're gonna talk about 3 things that cause this stuff.
okay,
That was gonna be number 3.
all right.
So we'll talk about that.
Ow, see?
That's the wild card.
Thanks.
We'll talk about it. So since we're there, so back on the questions. So 3A, if your pain, numbness, or tingling is reproducible, then it's reducible. And you don't have to answer B or C. So there's a piece on here, I'll just jot it real quick. So any problem, doesn't matter what the problem is. Actually, I saw this on television the other night. I don't remember what show it was on. I don't know. But any problem, doesn't matter what it is. We can do 3 things with it. I think it was on The Walking Dead.
That had to be, that's all we want.
So number 1, we can ignore it. Most of us do that. I mean, I've dealt with mine for 35 years, and probably the first 20, I just ignored it. Thinking it'll go away. Unfortunately, back pain and issues back there are not like fine wine. They're not gonna get better with age. They're just gonna create more issues. Number 2, we can ignore it. We can try to alter it. And what is altering it? Pain meds, injections, a lot of cases surgery, can be a way to alter it. But those things don't change, those are masking it, but they're not necessarily changing functionally, mechanically what's going on back here. And that's the problem part that we need to deal with. And so last is we can handle it. And that's what we want to talk about, is how to handle this thing. Anybody here, well, you 2 are excluded. Anybody here shorter or taller now than they were? So we're shorter. Anybody taller?
I've lost 3 to 3.5 inches of height.
Yeah, so the last time I measured myself was in my 20s, at which point I was 6'4". And so I lived through my life, and until recently, I don't even remember why, I decided to finally step up on the scale, and I've already lost 2 inches. And so it happens to every one of us with age or mileage, whichever term we want to use, things tend to narrow down, and it happens to all of us. So, so those are the 3 things we can do with the problem. Now, so what are the causes of low back pain, stenosis? Well, the first one, the HNP. You don't have to remember this. Herniated nucleus pulposus. It's our bulging disc. And I'm not the greatest artist, but so if we look at, it's not a car, I promise. It's probably more like a car than what it is, but. So who can tell me what that is? That's the vertebra. So the disc sits right in between. So if we look at this, so this is like I'm standing this direction. These things on the back side are the spinous process. Those are the little pointy things that we can feel back here. So the most common place for herniation in the low back, anybody want to take a guess? I'll say this, we have 5 of these in the lumbar spine. 4 to 5, absolutely. So let's say here we are at L4 and L5. So who is this? Well, usually this is somebody who's less than 35 years of age. And we've got a little of that in there, in this audience. So this could be yours. So here we are back on our picture. So we've got our disc right here, right in between this canal. This is where our spinal cord runs. Now, this area here is the frame, and that's where the nerves come out. We talked about the sciatic nerve being made of nerves from L4, L5, and then on down 1, 2, 3 to make the sciatic nerve. So with a herniated disc, if we think of the disc as a jelly-filled donut. So in a 35, and this number varies quite a bit. It can go as high as 55, and it can be even lower. But in your typical 35-year-old, disc is made up of two pieces. The outer part, which we call the annulus fibrosus, you don't have to know that. The inner part, or the jelly part, is the nucleus pulposus. So whenever, mechanically what happens, let's say we're bending down. So what causes pain here? Bending down or lifting. So what happens there? So basically we get a compression force from the top. This part is going to come up or stay the same. So basically this jelly donut is going to smush down, and it's going to pivot, and most of the force is going to go back this way. So what happens to our jelly donut? Well, the jelly comes out this way a little bit. We're going to bulge out this way a little bit. And in a healthy disc, that's fine. It's going to compress. That's its job. Shock absorber will come back up, and it's going to come back in. Over time, what happens is this gets a little bit weaker out here. Those fibers get stretched, and or if there's injury, then this bulge becomes a little bit more permanent. Well, where that is right here. And so a couple of things happen. One, we can get a little pressure on the central cord coming down, or two, we can get some pressure on the nerves coming out. Either one can cause pain just centrally in the low back, or it can cause this radiating pain or sciatica, whatever term we're going to use, of the pain running down the leg. So good news on this one, that one can be cured. We can take care of that one. I say that, caveat to that. 4 different types of bulging disc. One is the bulging disc, which is a mild thing. Most of us are going to have that. So the bulging disc. The second type is an actual herniation. And I can't write very well. And that's going to get a little bit more severe, and that's the part where the tissue out here starts to get a little bit more compromised, and it's going to push out, and it's going to stay out a little bit more. After that, we can actually have what they call a rupture. And a rupture is some of this material is actually going to leak out into the spinal canal itself. Once we get there, not much we can do about it. That's pretty serious. That's actually very rare. And I've seen it, but it's pretty rare. There's the last one that's called a sequester, and that's where that piece actually breaks off and is just floating around in there. That one can cause all kinds of problems. Also, nothing we can do about that one. That one has to be either lived with if one so chooses. That one needs to be fixed. So, on that one, so pain here. The pain on number one, the bulging disc, is usually down the back of the leg to the foot. So we'll talk on the next area that comes more to the side. This one is usually pretty specific, just straight down the back of the leg to the foot. So an interesting side note, if you have 100 MRIs of people 50 years of age or older, how many would you say, what percent would you say would have a herniated disc? 85%. Better thing, they have no pain, they have no symptoms whatsoever. So that's why I mentioned earlier, we have to be cautious whenever we have back pain and we go get our MRI. Cause a lot of us have, I mean, we've got stuff going on back there. But we have to be careful that, one, if we're at our surgeon's office, that it's a good surgeon, that it's a conservative surgeon, but they don't just automatically say, well, you've got this going on, let's open you up and let's go start cutting. I've got good surgeon friends who, and they'll agree with me, that just because it's in the image doesn't mean we need to go cut on it, because it may not actually be the problem. So, 85%. All right. I have a question on that. No, we don't. All right. That's the first time. The second time. And absolutely, if there's questions, feel free to shoot them out. We still haven't gotten to your third part yet. All right, so number 2. Let's just call this one arthritis. You can also call it degenerative disc disease. This is a broad category. Degenerative disc disease. And what this almost always encompasses is stenosis. So this one, so we had our picture of our 2 vertebrae. And this time, this disc that we haven't drawn yet has gotten a little smaller. It's got a little compressed. So on the first one, the younger person, we had a lot more space here. Well, now we've gotten a little bit older. That age has started to set in. That disc has started to compress down. So when that happens, several things take place. Number one, on the vertebra themselves, we start to see spurring.
Mm-hmm.
Up here, we call it lipping when it's here. And so the spurring or the lipping does a couple of things. One, they are now out in this central canal, and they're also creating space for both the spinal cord, and they can create problems for or impingement on the nerves coming down. But just as much, this disc is now compressed down. Same amount of material there, it's just now squished down. It has less water in there. So with this stenosis, arthritis, myalgia disc, or lumbar spine area, before we even apply a load, we've now got a little bit less space to deal with in both the central canal and where the nerve comes out. So, who is this? This is our, and I'm in this group too, over 50 years of age. This is, this is frequently, you go to the doctor, this is frequently called hip pain. The majority of the people that I see with this come in and tell me, my hip hurts. This isn't your hip. Your hip hurts right here. This is, you've got it both. So out here, 95 out of 100, maybe higher, is a back issue when it's talking about the hip here. But the majority of people in this category are going to have pain right here. You have to be careful because this can also be your third area. So we have to be careful of what we're looking at. So this one, so can also go out to the buttocks and all the way down the side of the leg. This one is increased pain with both standing and walking. These are the folks going around the grocery store right here. Why? Because that's the only place that feels comfortable. Or you're working around the house. That's where we get some rest and some relief back there. So completely different problem than our first issue. And so knowing where it's going and what it's doing will help us to know what to do with it. So in this group, if we have 100 MRIs over the age of 50, what's the percentage of folks with this going on?
85.
95.
Mm-hmm.
And they don't have symptoms. They're not dealing with any pain. They've just got the wear and tear. They've just got what's happening there, but symptomatically, nothing's going on, they're fine. So again, gotta be cautious what we're looking at in the imaging. That comprises a large portion of what we deal with, is that arthritis, degenerative disc, stenosis problem.
If they don't have any pain, that means they're good?
Means they're good. I mean, we wear out. So I have my own back. When I was a youngster, lifting weights poorly, I injured myself. Gave it a month, it was fine. 20 years later, it's not fine. So I had baseline scan done, I don't know, 6-7 years ago. My disc at L5S1 is gone. That vertebra sits right on top of my sacrum. I get the occasional crazy stuff, but I can still, if I manage it, if I handle it, I can still do everything I want to. Is my architecture not perfect? Absolutely not. It's kind of a mess in there, but I can still do the things that I want to do. Now I've had to work on it. I have to work on my flexibility. I have to work on my strength through here. I will get flares. I'll get things that do happen, and then I have to deal with them. But I definitely don't do number one and just ignore it, because if I do, then I miss work for a few days, and they're not going to let me do that. So I have to take care of it. So we can have our anatomy go through the normal age-related process and have degeneration and still have issues. There are a couple of times, one specific, but a couple of times when issues back here are emergency and we've got to have surgery super fast. One is if we lose control of our bowel and bladder. That means we've got a mass down in our sacrum, and that's emergency. You just go, because that can be a problem. If the other one is if you develop foot drop, that means there is definitely a specific amount of either, in number one, the bulging disc, or in two, the arthritis. Something has got out there and is pressing on the nerve to the extent that it's no longer just painful, but it's now hit the motor part. So that garden hose is pinched so much that the signal to move that foot's gone. That one, I might look at a person once, maybe twice. Odds are, I'm just telling them go. So pain is different, unfortunately, but we can deal with the pain.
Do MRIs show all of that?
MRIs will show number 1 and number 2. They will not show number 3. So number 3 is the SI joint. Now, when I came out of PT school 25 years ago, every therapist around town was just grabbing hold of that SI joint and pushing it, pulling it, cranking it, popping it, doing all this other stuff, thinking that was the cure to everything. They would lay a person down and look at, well, your leg's longer, this hip is up, this is down. And that was, boy, everybody was just going to town. Nothing was changing, but they were going to town, and that irritated the fire out of me, because there's more to the back than the SI joint. Except, the SI joint can be a problem too. So the SI joint. So if we have a stack of 5 blocks, which is the most important? Check out those 4. Oh, she left. I usually can't draw 5 straight up and down. So which is the most important block here to keep this thing from falling down? The bottom one, absolutely. So in the spine, we've got the sacrum. Call it the sacrum, call it the tailbone. It is the part in between the pelvis that acts as the capstone, keystone, if you will, between everything that's coming down and here are our legs down here. And all the forces coming up. So everything in the body centers right around that sacroiliac joint. And so there's a lot of things that can happen here. We can, the pelvis itself can rotate one way or the other. It can rotate this direction, and it can rotate out and in. By its nature, this joint is very stable. Rarely does it move at all. There are teeth-like projections in there that keep that thing from letting this thing move at all. However, it can move. Motor vehicle accident, car wrecks, can absolutely enough force take place to move that thing. A lot of folks, it would be all the female folks. Labor. Lady goes into, the child goes into labor, hormones relax all of that, all the ligament and structures in the pelvis, preparing the canal for birth. And especially if it's a hard labor, that sacroiliac joint can move. And actually that's a pretty common problem, right there. So what do these folks look like?
Me.
Let me get to the right page. All right, so age. So we saw in the first one, it's a younger person thing. It's, 35, 40 or less on the bulging disc. Now that's not to say any of these three can't happen in the same person all at the same time, because it can. The second one, the stenosis, the arthritis, is 50 years of age or more. This one, we can all get this one. It can be as young as 3 or 4 and on up to 95 plus. This can happen to anyone. This causes, people with this have increased pain with sitting and changing positions. I can tell you, I deal with both number 3 and number 2. So something else that happens with these folks is they're shifters. And I am always shifting, because I might have an irritated spot over here. I can hold it there and it does okay. It starts to get problematic and I'm going to shift over here. Sitting for a long time can just really irritate that spot right there. Those folks will also shift. We're going to sit over here. We're going to sit over here. Now, truth be told, 3 and 2 tend to go hand in hand quite a bit. Rarely do we just have an arthritic low back that we're probably not also dealing with some garbage a little bit lower. So, bad thing about this is asked about MRI. I just looked at an MRI of a gentleman. He's 84? In his early 80s. Now he's had scoliosis. So now scoliosis would fall under number 2, because that would be an arthritis problem. But he's had an issue with the scoliosis in his spine, and his MRI shows that pelvis tilted. So sort of technically, yes, he has a sacroiliac problem if you just looked at the picture, but his problem isn't there. His problem's in his spine. So we have to be cautious what we see in the images, and we have to be cautious how we treat that, because just because it's crooked or off doesn't mean that's the problem. And there's ways that we can test to tell where the problematic areas are. Most of the times, if we're dealing with an arthritic back and got a lot of pain and we're just not making anywhere clinically, the problem is we probably ignored that part. And even though it irritated me when I was a young therapist and everybody cracked it on the SI joint, we may have to go back and actually look at those. So a lot of times that can be a key part of what's going on. So we get down to question 6. Top 3 common causes of low back pain and sciatica. The SI joint or pelvic problems. You have pain when you're sitting. B, the stenosis, degenerative disc disease, or arthritis. You have pain when you're standing or walking. It's your grocery cart. Then C is the herniated disc. You have pain when you're bending forward. And more so, they tend to have it more trying to come back up. That's when we tend to see that.
Yeah.
So, what does successful treatment look like? Again, 7A, I hate to use this term, but I'm going to. It's a European-styled therapy. Now, why do they call it that? In a lot of the European countries, they've got government-run healthcare, which means everybody shows up, it's free. In that system, care tends to be less high quality. It tends to be get in, do the easy stuff, and get out because there's just so much happening. The folks over there that are paying bucks for they expect those folks to come in, put your hands on you, to do everything that needs to be done and have a real hands-on approach, as opposed to the way we did things 25, 30 years ago, which is just throw a hot pack on it, throw some ultrasound, maybe some electrical stim, and those things, which those things are fine, but they don't get down to the nuts and bolts of what's going on. So, again, I hate to call it, maybe I'll just start calling it the Texas approach. I don't know. But it's the European style. B, it's definitely hands-on PT to move the pelvis, especially in regards to number 3 here. It always has to come back down to strengthening exercises to stabilize the pelvis and the low back. If we don't throw the strengthening piece back on, strengthening and the flexibility, then we can knock the pain down. A week later, it's going to come right back. Again, I mentioned that we do incorporate at times manipulative therapy adjustments into what we do. One or two of my fellow professions, I think they do that part, but they leave off the next part, which is the important part, which is then the strengthening, the stability of these parts. We want to get this to a point where it works like mine does. I have to deal with mine maybe every year and a half, and that's it. And when I do it, it's for about a day. I deal with it. I'll do a treatment on it. But then I'm going to do my homework. I'm going to do my stretching. I'm going to do my exercises that I need to keep this under control. So the strengthening and the exercise to stabilize. So on D, and I'm going to come back to D. Let's talk about E. Every once in a blue moon, and we've got them over here, it's necessary to do some lumbar traction. Call it decompression, whichever term we want to use. It's a machine that's just simply designed in the case of, well, every now and then here, but more so on cause number 2, just to take and open up those spinal spaces. Where we can put a certain amount of pull on those and get some space in there for those nerves to breathe. There's a debate about if we can actually make a person taller, if we can make those discs absorb to make them taller again. And I'm going to say what I know is through research, through the evidence, is that maybe in that 35 to 40 and younger crowd we can. Once we pass that 50-55 mark, that jelly donut is no longer a jelly donut, it's a hockey puck. And so it is what it is. Now, it still can be beneficial to open those spaces up, to give those nerves some room to breathe and to take the irritation off of them. But I'm not going to I'm not going to get my 2 inches back by jumping on the table. That's that time is already gone. But again, normal process. So traction to relieve pressure on the spine. So D, here we're talking about, it's a class 4 laser or dry needling. And I'm gonna throw some manipulation in there as well. So what has to happen is when I have a person that comes see me, if it is a simple case of an occasional bout of pain that's not significant, it's usually simple enough that we can examine and find what that mechanical issue is. Is it tight hamstrings? Men especially, young men especially, and we're so tight back here we can't even get down there. Over time, that's going to cause some changes in how the lumbar spine functions. We're going to create some issues here. There are some cases where it's a situation of too much flexibility here. So mechanically, there is usually something that we can identify that we can correct and address to change how this thing is working. So when that's happening, it's pretty easy. We identify the problem, give you the things to do to change, in your case, what's happening, so that then you can deal with it, and maybe we never have to see each other again. Then there are folks that come in who are sitting on about an 8 out of 10 pain level. And I talk to them for a bit, and I put my hands on them, and they jump and flinch. Those are the folks that odds are I'm going to have to employ something. You've got to get that tenderness gone. Sometimes pain meds can help. Sometimes injections can help for a little bit. Sometimes they can help a long time. Some of the procedures that can be done. But there are very specific muscle groups that are usually responsible for the pain that we deal with here. We're at hunting season. The back strap that runs from here all the way up to the base of the skull. When we're dealing with the herniated nucleus, the bulging disc, that back strap, when I push in on it, it's going to be as hard as a rock, and we've got a low-grade or a high-grade spasm going in. So the purpose of the manipulation or the dry needling or the laser is to break that up. So way too much information, but muscles contract through a unit, and they basically slide back and forth. There's a chemical reaction that takes place, and the brain tells that muscle to contract. And whenever there's trauma, the chemicals that tell it to contract don't release. So that muscle just stays contracted, and that's where we get that low-grade spasm that just sits there. So something has to break that up, whether it's, again, those three things. Maybe it's ice, maybe it's heat. Usually by the time they get here, it's too much for that. But there is a way that we can disrupt that. And so once we get that piece to where, again, we can push on that and people aren't screaming at us, we're halfway there. Then all we've got to do is find the mechanical thing that's not working right. Is it an instability here at the SI joint? If it is, a little adjustment. There's some muscle energy things that we can do to reduce that. In the case of one that's just floppy, that's moving all the time, sometimes we'll belt that. We may belt it for up to 6 months. You don't have to be here for 6 months, but something to keep that stable, let those ligaments lock. Whenever we have a pain, again, L4, L5 is always the problem area, L4, 5. Usually, L4, L5 is going to be really mobile, and either the one below it or above it is going to be stuck. And so that there's some things that we can do to help unstick those to restore normal movement. So that's what you want to look for, whether you're taking care of yourself, poke around and see, do I have all this crazy stuff going on? Number 3 and number 2 tend to start either here or some combination right there. So if that's what you're feeling, odds are it's one of those. It could be as simple as doing the right stretches. It could be. It could be a little bit more in depth, as long as we're not dealing with drop foot or problems with the bowel or bladder, then there's still good hope that we can make some headway. Again, turn you into a teenager? No. We're designed to wear out. So we just want to manage that and identify what we need to do to keep things moving in the right direction as we move forward. So, all right, so does anybody have any questions for me? Yes, sir.
What's drop foot?
So drop foot. So the muscles that lift the foot up, some folks can have a stroke, and the same nerve pathways are involved, and you'll see that they can lost control on one side. Well, usually in the leg, it's this foot right there. So drop foot. So we normally walk, we lift that foot up and come down and place it. If we lose that control, then we're doing that. Could be just a heavy leg. In some cases, I had a guy in here, who was this, yesterday, who he couldn't make it move at all. The other side he could. In his case, he had not the herniated disc, he had the second one, and his was in the central canal, and it was pushing on both nerves. So we're trying him a time or two. Odds are, I'm going to tell him, you got to go, because it's just too much. So that's drop foot.
It can't be reversed, can it?
It can.
If it's real bad?
If it's real bad, I've seen it reversed. It depends. So we talked about the bulging disc. If that disc can be reduced, if it's somebody my age and up, no, probably can't. If it's no, I have seen it, but likelihood goes down. A younger person, 25 to 35, easily, as long as that bulge hasn't gotten so big, as long as there's some extension, some McKenzie work that we can do. In that case, sometimes the traction table can help. There is a good chance of reducing that as long as as long as the jelly hasn't squirted out of the donut. After that, then you've got to get that pressure. You got to keep that pressure off. So what does tend to happen is when, let's say, using the garden hose again, you prance off on that garden hose, nothing comes out, you let go of it, water immediately comes. Well, if you hold it there long enough, or if you keep it crimped, say through the winter, that hose, it's going to take it a while for that water to come out again. Same thing with the nerve. If it's a short duration of impingement on that nerve, it can come back like that. If it's been going on for an extended period of time, the likelihood of it returning gets less and less. So the quicker that it can happen, the better. So.
Does, chiropractors and masseuse, do they not help?
They can help. So, and again, that's why I like what I do. And I don't like doing massages, because that's a lot of work. My hands get tired. But it can be very helpful. So I do a lot of manipulation. I do a lot of adjustment. I find that what I do with my dry needling is more effective. And I say that when I adjust the spine, I'm making some change right here and it feels good, but it's probably not changing much that's happening with the musculature on the side, that bag strap. And that's what we need to, that's where the pain is the muscle here coming down here, then as it comes out here. I deal with this, not on my own, but I deal with more problems here, and I deal with it better through my kneeling than I ever have with my adjustments. But it can definitely be helpful, especially Luke's opinion. That works a lot better in the thoracic spine up to the neck. I get great results manipulating there. Lower, I can manipulate, but I usually have to come in and do something else here. Now here's what they miss. You have to reduce the pain, but then you've got to restore normal movement and strength. If you don't add those pieces in there, then yeah, you feel better until you go back. And that's fine, but I want you to get to a point where you're doing well and you don't have to come back. It's not the best business model, but it's the right way to do it. Because I don't want to go see a healthcare person for mine. I mean, I'll see me and whoever I get to take care of mine whenever it happens. But I don't want to have to go pay for ongoing, make me feel good. I want to feel better, and then I want to know what I need to do to keep it moving in that direction. So good things, just don't think they go the next step which is the most important one.
To stay healthy.
Gotta stay healthy.
To keep going.
I can't manipulate my neck anymore, so every once in a while I'll get my other PT to manipulate my neck.
And you hear a lot of cracking.
Oh yeah, it's a lot. But if I took care of my neck as good as I did my low back, then I'd be in a lot better position. But I kind of ignore them. I do number one, I ignore my neck. I handle what's happening here, but probably within the next 4 or 5 years, I'd better get on doing number 3 on my neck before I find myself in trouble.
What about wearing back braces for posture purposes?
So the problem with back braces is if you are working and you're lifting a heavy load, they can help stabilize there. But if you rely on the back brace or neck brace for posture, then the muscles aren't doing their job. So you can never take it off again.
Oh.
Because we need the muscles to do that job. Whether it's here or here. So it's all about movement and strength and stability. So we have to get that piece. It's not enough just to make the pain go away. Lots of good people can make the pain go away, but we want it to stay gone.
So it wouldn't do any good to have a posture brace just to help your back.
Not really.
Okay.
They're helpful when you're lifting stuff, if you're not using good mechanics. They're helpful after surgery, because we don't want you to move.
Oh, okay.
But after that, we want those muscles to do their job. The muscles, so when the back gets injured, we rely heavily on the ligaments and the discs to protect us. And that's why when everything gets weak, why we've got to go here, because they just don't have the strength anymore to hold us upright. But ligaments, they're designed for car wrecks and things like that. They're not designed to keep us upright.
Okay.
So it's all about the strength. You don't have to be Arnold Schwarzenegger, but there's a certain base amount of strength that we need to stay vertical and erect. So, yes ma'am.
So would it be helpful to do, like you said, muscles, right? So
Mhm.
strengthening the muscles, would
Yes.
that help? Exercising, but what about lifting weights?
So and I'm gonna get back to lifting weights can be very good. Strength training is very important. But if you're in a high level of pain, if you're at a 5 or above, you're not gonna gain strength until that pain comes down, because you're in a state of inflammation that those muscles are gonna get more angry. The more that you try to force them through it. There's a time for no pain and no gain. When that thing is trying to lock, that's not the time. So once you can get pain down to say 2, 3, then you can start working into the resistive training, the exercise. It is the machine is built to do work, and part of the problem is that it stops doing work. So we have to throw extra work in there. Once you deal with the back issue to successfully manage it, you will have to work at it. There's just not a way of getting around it. So, and that can take 3 minutes a day. It can take 3 minutes every 3-4 days a week. But there will be something that has to be done. There's no way of avoiding it. Yes, ma'am.
When you've got, your, I don't know what it is, the little hole within the spine that is closing up.
The foramen on the outside?
Yeah, from the arthritis, and how do you either stabilize that or, somebody told me laser surgery.
I've seen success with laser surgery, and I've seen not success. So from my side, before I would go have my back even laser surgery, if that's a word. So we get on the side where the nerve goes through the foramen. So we know that as it encroaches and compresses, that nerve is going to be irritated right there at that point. So the first thing that I want to do is see if I can just open that up, and I can do that through some positional things that we can do. It can be done through the table here, but I want to know, can I take the pressure off that nerve and get that inflammation in the nerve to come down? Because if we can do that, then I can avoid surgery.
What's the arthritis? How come you get arthritis and can you stop arthritis?
Arthritis by its very nature is inflammation of a joint. And so the day we're born, we start developing arthritis. It is a natural progressive problem. It does tend to happen more with people who mechanically have an issue. I mentioned men and young men specifically, so I'm kind of picking on you guys, with tight hamstrings. Well, when you have the tight hamstrings and you go to bend forward, that flattens the low back out. That changes the mechanics that happens here. That means for those guys, L4, L5, L5S1 is automatically going to start the deterioration process that much faster. And so if we can it be stopped? Yes, if we can eliminate what's happening to create the inflammation. And that's a big question, because some people are more prone to arthritis based on their genetics. If you have things in your family history, rheumatoid arthritis, that's a different one. There's certain types that there's not much we can do about. But our normal progressive arthritis, again, starts the day we're born, and it's just wear and tear. For some people, it just gets more aggressive. There are some people who have really good success with the minimally invasive spine procedures, where they just go in and kind of scrape that arthritis out. And I've seen people who've had it done and struggled for 6 months or more trying to regain where they're trying to get, even with that minimally invasive surgery or laser surgery. And there are times that's the way to go. I would always opt for non-surgical approach, as would my surgeon friends, if at all possible, to try to decompress that nerve through a natural approach. And there's some ways that we can go through that, and we can usually find out pretty quickly. If we've got that going on, we probably also have a lot of that low-grade spasm I was talking about, in which case, step one, let's get rid of that and see if that, because as that thing contracts, it's going to pull that spine down. And so if we can open it back up just by eliminating the force.
How do you do that?
My
That's
most
your
successful
secret.
approach, my most successful approach is through dry needling, followed by some manual work and stretching. Now, we just started using a high-powered laser. We're seeing good results with it. Some people just are really gun-shy about needles. I don't like needling myself, except that I know how effective it is. People ask me what is dry needling. Well, it's acupuncture, but I'm not using your chi or your meridians or your yin or your yang or your life force or any of that stuff. Nothing wrong with acupuncturists and how they do that, but we know very specific physiology, anatomy of what's going on, and we found that we can use those needles to go in and disrupt that spasm.
Where does it, the sciatic run through your pelvis there?
So on the pelvis, so again, it's going to come off of, so here's L5, here's L4, and we're standing, I'm standing this way right now. So my head is pointing that direction. So out of L4, L5, and 1, 2, 3, it's going to come on the front side here, and it's going to come out right there in the middle,
On your right side,
on both sides.
both sides?
Yep, you get it on both sides. And so it comes out right there, right to the right of your sit bone, of your butt bone,
Yeah.
just to the outside of that.
And so when the hip, when you get a hip replacement, what do they take the femur out?
Yes. So here we are with this pelvis here. Here is the socket that the ball of the femur sits in. So when they do a hip replacement, they're basically going to take that off, and they're going to put a new steel ball there, and then they're also going to put a new hip lining. in there. So they'll put a brand new,
Yeah,
every now and then they'll just do half of it. Sometimes the socket is good, but usually they'll put a new socket and a new ball.
but then the sciatic runs through that,
It's pretty close.
where?
So here's the femur right here.
Yeah,
So it's right here, and the sciatic nerve is running right beside it. It's very close.
so when mine tweaks right there and I have to jump and go like that every so often, what's happening? Is it the hip? Is it the sciatic? Is it both? Is it what?
If it were your hip, I would tell you would feel it on the front.
Well, I do feel it. I feel it on the front. Sometimes I feel it here, but mostly, like, you see me squirming the whole time you're talking, down here.
So I'm gonna say you have problem number 2 and problem number 3.
Right.
So it is, would I suspect that it's being compressed here? I've never really seen that. Now, the sciatic nerve comes out, so there are muscles that come, I'm gonna come over to this side. There are muscles that run from here out to the side of the femur right here. One is the piriformis. There's one right below it that connects right here that creates all the rotation in and around the hip. Well, the sciatic nerve comes out 4, 5, 1, and it dives, so it's coming out, it's behind. It's gonna come out, and I'm actually way over here, forgive my drawing, there's another piece over here. But it's gonna come out in between these two muscles right there. So we talk about piriformis syndrome, probably heard of that if you deal with back stuff much. So piriformis syndrome is in those muscles as they're on the backside here. As that nerve dives through, if they are really tight and in a spasm, they're literally gonna pinch on that sciatic nerve, which is about the size of your thumb, and create that shooting pain right there. So what do I do about that? We gotta deal with the piriformis and the musculature. How do I do that? We can try stretching, we can try some muscle relaxation, some muscle energy business. Best approach, a needling. Yes,
Is
ma'am.
there a stretch or an exercise when that thing goes crazy on you that will relieve the pressure of that sciatic nerve?
The easiest one for what she's talking about, the easiest stretch to manage that is up and
Okay.
over. Best laying down. It can be done sitting in a chair,
It just,
coming right there, because
it
that's
might
gonna,
help a little.
yes.
Alright.
That's one of the best ways. I have to do mine every now and then.
Yeah, sometimes it just gets bad and you think, okay, what can I do for it?
Yeah, that's my go-to treatment for it. Now, I can also, laying down, I can stretch the hamstring out a little bit, because it attaches right on that same bone, right next to the sciatic nerve.
Alright,
So,
depending on which side is.
yes. So, I don't just generally offer free consultations to anybody to anybody that walks in. But you guys were kind enough to show up and listen to me gab on for a long time. I think we've got spots for about 5 on Thursday. If anybody wants to come in, I'll be glad to run through 15, 20 minutes and evaluate and give you a good consultation of what I think's going on and what could be done. If it's just a mild thing, some stretches, some strengthening that needs to be done, or if it's some severe stuff, that's what I would recommend that we would want to do to take care of it. So if anybody has something, Ashley can put you down for a free consultation, and I can keep answering questions. Yes, ma'am.
I'm 84, and I say this because you say the older you get, the harder it is, but I'm told that I have no cushioning between my vertebrae.
Mhm.
I've also got sciatic nerves. So, and it's even gone to where it's affecting the bowel and the bladder. So if I got much hope for.
Now, so bowel and bladder is one that gets us interested.
Yeah.
So bowel and bladder, you're welcome. If there's an issue that, and I assume you've had some scans at some point recently.
Yeah.
If they've looked and they don't see any masses in your sacrum, then there's actually another issue that can be ongoing that deals with the bladder. And I hate to say this, but there is a phenomenal protocol with the needling to take care of that.
Well, just today
Yes.
I went to a urologist and he's got wires run in to the nerve.
Mhm.
And I've got this little, like a TENS unit almost like, and,
Urologist or neurologist?
urologist.
Okay. Are they back here or are they on your leg?
They run into my back
Okay.
and I've got to take over everything, holding everything. I'm not supposed to bend and twist and.
So don't bring you
Till
up here.
Friday. But, no, I am amazed, but I can tell a difference already in the bladder habits.
Good.
And these were just put in this morning and
Wow.
I'm flabbergasted.
Do the electrodes come around to the front?
There's a little, I'm wearing a belt and there's a little electrical thing there, and then I've got a cell phone that's got an app that I can up the
Okay.
power and everything. to.
Yeah. So we have taken and modified some of the things that we learned from a urologist
Yeah.
on managing incontinence. And if you had asked me 5 years ago, Ken, is there anything you can do for this? I'd have said, no, you're crazy. But so it can be dealt with in a number of ways. There's a way that we can, and a urologist developed this. Put a couple needles in the lower leg. And I have had more success in dealing with incontinence issues through that than the other ways. The other ways are dealing with the nerves here and then getting into the pelvic floor itself. I have never yet had to go into the pelvic floor to manage it. And
Well, I'm just quite flabbergasted because
it's amazing what one might consider to be a small issue, how big of an issue it is.
Well, actually, I've had some incontinence since like the early '90s, because I retired in '94 and I was having some problems then, but it's just gotten ridiculous lately. And, so they finally, I've seen one neurologist, they even put a screen in at one point. And, then went back to another urologist and he says, I'm gonna send you to this other doctor that's new, just out of school, and said he's got more expertise than I have, and so this is what we ended up with.
I mean, correct, now, is that somebody here locally, somebody in Fort Worth?
He actually has his main office in Arlington, but he does come in on Mondays, down on South Hewlin area,
Okay,
down there in the Southwest Hospital area.
yeah, I have seen, I'm glad to hear that. I've seen some
Nuss is his
incredible
name.
results
Yeah,
using that electrical piece to
Yeah.
manage incontinence.
yeah,
So, good for you.
yeah.
Keep our fingers crossed. And
Yeah.
Wear that for how long?
Well, they're gonna check me out
Uh-huh.
Friday, and I don't know if they're gonna pull it out
Has he had a
then,
screwed up
or they're gonna leave it
sciatic
for
nerve?
what, but I got this
Mine-
little belt about that
Does the
long, and it's got a
sciatic
little
come
like,
around to the front
not
of your
even as big
leg?
as a little aspirin box,
Yeah.
the little magnetic things, and
And
then I can
I've
control
broken my back and I got
With
all
the-
that stuff going
like
on.
a cell phone.
So
thing. They
are
gave
you-
me
are you
with an app
diabetic?
in it how
so,
much
so we can have
power I'm giving
we
it,
can
you know,
have-
battery power, so.
foot drop
You have to rub it day
specifically
and night.
associated with
Yeah.
specific
Yeah,
nerve
I can't-
impingement.
I've got a.
We can also have foot drop
Two big sheets.
when
of-
it's
I forgot what
compressed,
they call them, kind of like
especially
tape
down
stuff.
low down here.
It's holding everything.
So there are
in
different
place, and
areas
that's the reason
where-
I can't bend
But if yours is
or
more
twist
on the
because
inside.
they eventually pull
Yeah,
everything
it
out. And when they
comes
pull it
down
out, it'll
here.
just pull wires out too.
And then
and
it comes
they're only-
around.
They're only
down
about
like
the
that.
size of a
It
dental
hurts
floss.
like sin.
Yeah, but.
So are you, I mean, I see you lifting that foot up and down.
Yeah.
You know, it doesn't
And
help,
make
it
them-
doesn't.
I
bother
get-
you.
I get much more concerned whenever I see a significant weakness there. As long as you've got good motor control there, then there's probably a good chance that can be changed, because that means the signal is still
Yeah.
getting there.
Yeah,
may
but,
be
you know, it's like
impinged
I
and
can't
reduced
cross
somewhere.
legs and
But
twice tonight.
it's
I
still
thought,
moving,
you can't do that.
unless you're diabetic and have neuropathy, then odds are it can be unloaded and get a better chance to get more back.
Because I put icy hot patches from here all the way down the back of my leg to the front of my
Yep.
leg.
My favorite thing is, blue MUL.
Yeah, and I have some essential oil blend around here.
And then
Um,
it's,
Does it do anything? I don't know. People swear by the CBD oils. Do they do anything?
Yeah.
I don't know. I have some icy, some mineralized by the
I
bed that
remember
I'll,
when I
every
was
now and then I'll
using, my
use.
daughter-in-law says, "Why don't you try that blue stuff?" And I did. I mean, it made a believer out of me.
If we can tell the brain that it feels good, guess what?
Yeah.
It feels good.
And you know, I kind of smeared on with my fingers, but I can take, when I'm really hurting my back, I can take my knuckles and put pressure on there, and that does more than just trying to
Yeah.
do it, massage it with my fingers.
I've got one of those
'Cause I'm on
pressure
a-
fingers.
Not, everything's on the right side where it's anymore, I don't really have pain, but I'm stiff. And that can drive you crazy, cause I mean, that's as bad as having pain almost.
I've seen a number of people who are been dealing with back pain for years, if not decades,
Yeah,
that we've shown them how to get some good relief.
yeah. Well,
It
in
doesn't
'02, I
work for
went to
everybody.
therapy once, and then I didn't have any more problems really till about '06, and it's just, now it's been going on about 4 years, and the last time I went to therapy for that, I was riding a bicycle for 10 minutes and they put me for 12, and then the last day, they had me ride it 15 minutes, and that last 3 minutes, that hip bone come around and raked that side, and it's
Oh,
still sore.
No.
And that's 3 years ago. It's, it's getting better all the time, but,
I'm gonna say there's probably a little something that could be done on that one.
yeah.
That this of everything that comes through here, this pain right here is the
Yeah,
absolute
Right
most
there,
common
and
thing
it's
that
on the
we
right
see.
side, it's not on the left,
We
it's
see
on the
it.
right. Everything's on the right side.
Now, Daddy's foot
Drive me
was
crazy.
on his right side, and so whenever my sciatic started to screw it up, I had fallen, and, I broke my back.
Oh, no.
Oh, my,
God. I took a bad fall in June.
Be careful.
Do I have to see a doctor before we come here?
That's a loaded question.
I know, I bet it is.
No, but it depends
No,
on your
I know.
insurance and for how long.
I would like to come in and see you, but I'm gonna have to wait till I get all these wires and stuff out of me.
Yeah,
We
because I'm gonna wanna move you around and do some things
No.
and see, so let
I
that
wait,
settle
I gotta
first.
wait till I can wiggle.
Absolutely. But hopefully, when I do see you, that problem will be resolved.
Yeah, hopefully.
Cause
I'm just,
I've seen a lot of people
Your Medicare for it?
that it
well,
resolves.
when they got ready to do the procedure today, I said, well, just a minute, I gotta take a side here. I've only had to go to the bathroom twice since then. And usually
I think
a
I've been
couple
more than
of-
that.
If I don't watch myself and go at least every 2.5 hours, I'm not gonna make it there without flooding
Yeah.
myself.
Have you told them that your back hurts before?
So this.
Just fine. Nice to meet you. All right.
I would just call her office and, or my doctor. If not, his name.
So, I was just telling, so PRP, matter of fact, I've got another patient that I'm seeing now who came in last workshop, same situation. PRP, what I do with my dry needling, I'm not using the blood product, but what I am doing is going into the same location. And I'm, so people get nervous and say, well, how deep do you go? Well, I go all the way. So I'm going into that location of problem and I am needling on there. I'm creating that inflammatory response there.
Does the insurance cover that?
I can say what I do is significantly cheaper
Yeah.
than the PRP stuff.
I have,
So, and they know better, but
I have
I'm-
Medicare and TRICARE for life.
what is it?
What is what?
Dry needling,
And do I have to have a doctor's referral?
$35.
Yes, I have to have an order for physical therapy to bill Medicare.
It's a lot cheaper than my $7,000.
Okay,
Yes.
I get that.
And so my take, I'm not using the medication in there,
Give it to
but
me.
I was reading a thing, it came out
It doesn't have to specifically
over
say
the
dry needling
weekend.
or anything.
Now, this was looking more at
PT,
Yeah.
Gallon treat,
patella
they normally
tendon.
write it.
But,
Yeah, we get-
um, even see one from back here, but dry needling and PR
I've had him
two
for over 20
was the
years.
exact same.
And
As
then
far as
I've got
results, as far as
urologist,
training.
neurologist.
Yeah, what I do, I mean, we use the same needles,
No,
I go deeper.
they're basically don't work that
We
hard.
get down
This
to
doc,
business.
this urologist I was in, his main office, and where his equipment like what he did today is actually fine. But it's only about,
2 months ago.
45-minute drive
I
from
lost the
Westwood,
window.
you know.
And so I got 3 places screws here, going back.
On I-20,
Couldn't go
on
to work,
I-20,
couldn't work. They got
and he's
hot.
only about 2 blocks off.
ripped?
I-20.
Yeah, I broke rib 4 through
Exit
11,
on the Cooper.
shattered 2, one went through my lungs, so I got 3 fractures here. Broke 4 of them inside my right
Yeah,
clavicle
so,
and clavicle. Or scapula, sorry.
Just to build the insurance, we
How
have to
did
have.
you do that?
Wow.
Got locked up
We
my
did get
truck
some,
window,
call it
Oh.
direct access.
do about 80 miles an hour,
We
and I
can
went
treat
through it.
patients for 2 weeks without.
So you're doing pretty good then.
Oh yeah, I was
Insurance
they had me
is
September
paid
15th, I spent 6 days in the ICU and
without a
another
doctor's order.
week in cardiac ward.
So
and
legally
then
we can
30th,
do it,
I
we
was
just
back at
can't
work
bill
for a while.
insurance.
I'm supposed to be,
It's
but
a
I feel
whole,
sick.
it's a.
Well,
gig.
yeah, and so I always pick on rodeo and the horse people. Because you can't really slow them down, cause they got stuff to do
And all
and
of a
things
sudden,
to take care
about
of.
2 years ago, I couldn't
So
get
it's gonna be
prescription.
clear Thursday, go back to work, but
I
I'll be
used
working full time.
First Express Script.
I had to relearn how to breathe again,
And,
my brain stopped taking deep breaths, so.
Take care of all that hardware.
It's all good, I
And he
went
said
back,
I could
I
protest.
go back, told me to
Well,
follow.
I didn't know all the terminology and everything, so I went to my
2 weeks ago,
doctor and I said,
and he said,
okay, I want you
I
to
have
protest this.
and everything, I feel it
Because
great
he knew
there.
all the
Feels good.
Right.
Great.
medical terms and all, I
Right
don't know
now.
about.
Did you go to JDS?
No,
FDA
Eric
decided I
Southwood.
didn't need to
Oh,
be
they're
taking it
across
anymore.
the board.
Okay.
Yeah, I hope
Yep.
John Doe and they call me Victor, 'cause my wallet and my phone was still in the truck.
What I do or don't.
You know, I agree.
I hope it's
I
Victor,
really
Victor,
agree.
who is
It-
Victor?
it- Well, I'm not thinking about it. How did
He's
you
taking
roll?
everywhere.
Oh,
I think it'd be helpful.
tripped on something?
Yeah, at a minimum,
I was at my
drop a couple dollars and you're not introducing anything different in your body.
I'm sorry,
I have a
and-
ticket. That's all I get, you know. I had no follow-up to strength training or
Try.
stretching.
That's the important part.
See
You've gotta
somebody
get
I
it
wanna
strengthened in
see
order,
real-
otherwise
real
you're just,
fast.
like, you're.
I got
And
2 MRIs, one back
Started
like 08,
walking right
9,
across the entrance and they, I didn't realize that
Oh, I
they
got
had
injected.
dropped,
And you're coming in when?
Thursday from one.
Okay.
So that first step was the Kelly.
Thank
See
you.
ya. My pleasure.
You know, I fell in June, but
Thank you for coming.
I was emptying my swimming pool, and I needed to move the pump because there was one big puddle out there sitting on the edge of it, so I went going down the steps, hanging on the rail. It started raining and my hand slipped.
Now, is it
Well,
back
I ended
here?
up
Is it through?
like the end of
It's
this
on the
counter,
front.
you know, on the floor, head drop, bang,
So,
bleeding, open. My kids, oh, it's too
It
hard.
could be, so we talk about, and
You
obviously,
should be out there doing that, blah, blah,
I would
blah.
have to move
And
you
then
and
right
do
there in
things to
my
find
house,
out.
and I said, I stay
So we talk about the sacral iliac.
both
and
my
we've
daughters live in 2-story homes.
We've got,
Look, you
a
gotta have 5
skeleton here.
steps up
I've broken
and
mine.
open a gate before you can get on their porch.
So we, 99 out of 100, our problem is right here. Sacrum sits
In the
here,
front. 5
but
coming out of the
occasionally-
garage into the utility
so the
room.
other half of
There on
this
the patio,
is
there's
here.
14, and there's not a rail on
Occasionally we
any of
can
them,
have
not even
that
the 14 stairs.
problematic here.
Your
And I said,
grass walls.
So,
Yeah, and the
First
first
time
one's
it
got
happened,
like
I
4
was
or 5 steps up
going
to
to
the little
get, I
porch
was
to get
fixing
in
to
his
step
house.
off the curb in front of the bank.
So I says,
I just stood there and
shut
looked.
up.
Whenever
I
First
said, "There's
National
another
was still,
here." I says, all of you, look at your steps.
no,
Then
Citizens,
you're trying to
First
tell me.
Financial, whatever,
Then I-
was still downtown, and I went to step off the curb, and it shut off. And I'm standing there, and I was just, I could not move, because it hurt. Oh my gosh.
yeah, a lot of times I would wanna come in and move this around a little bit, see if I can reproduce it. If it is,
Oh, so she sees
it'll
the
help
same
us
group of
identify it.
doctors.
If it's there,
My doctor.
there are some things that we can do there. First thing is see if we can
Well, I see a cry for
move
like
that
every
just a
3
little bit,
weeks.
or stabilize it
That kind
to
of
change what's happening
keep
there.
me going a little bit limbered up.
My pants
And-
have gotten,
My son,
With my
he's,
tummy.
he and his wife the last couple of
you
years.
can
had
tell
Problems and he's getting ready to have surgery.
this
today.
hip's higher than
Everything.
this hip,
Mhm.
And he,
and my skin goes that way, and I'm just
not
going,
putting weight on his.
okay, that looks really weird.
And so I know, so I'm watching you stand, cause you're standing exactly
So
like
when
I
I
am.
fell in June,
Yeah, I stayed on this side,
behind me, there
So
were a couple.
I'm
and then I'm
usually-
rocking back and forth.
I'm usually a
And,
left leaner because
They adopted
my
me.
left side is more
And they
problematic,
got
so
out
I'm
pencil
usually
papers,
here, cause that creates more
Here's our
stability
phone
there for
numbers.
me.
he said, next time I have to have.
Sometimes I have to give it a break, but then I have to go back to it.
Edge
So
of
that really, that tells us a lot,
borderline, I mean,
that there's at least an issue here,
and I live by.
unless you're 35,
Oh, okay.
I'm gonna suspect that
And
there's
so,
issues there as well.
they've been coming in
That
mowing my lawn,
hurts.
and the other
It's
night,
a-
he put
you
a
know,
garbage
it's a-
disposal in for me.
Oh, that's so nice.
So,
I've
and,
been
it's
here.
just wonderful having
That's where I
somebody
broke my back.
come in.
Yeah.
And they went in and
But
blew
I've heard
female.
about all that goes on in our church.
And I figured I was gonna have
Yeah.
problems with
All
it.
that kind of stuff, so.
Sometimes it radiates all the way
And I imagine
across,
when
but
I
most
have
of the
meetings
time it's
in
just a dull ache.
February. I
And
got a
I would suspect in your case,
I broke
I'll
that.
be having a lot
So
of
how are you
withdrawal.
doing here?
I bet.
But
With
I'm
that?
also going to, well, just like the other night, I made a
Sometimes it flares
Some
up and
cream
hurts
cheese
like
soup
sin,
or-
and then other times it
Uh,
just,
thing at church,
and I asked that,
and I had 5
the
cups of
pelvic
water,
floor
and I
itself,
had
we
those
consider it's a bowl down in the bottom.
Rubbermaid
Part of it
cups with
attaches
a
here,
screw on
but
lid,
part of it also comes up and
that, you know,
attaches
cup
through
soup
here.
like that,
So
that kind
that
of stuff.
could
Just right,
Be
so
re-
I just filled
basically
those up,
you're a
there's 5
mess.
of them already in the freezer waiting for.
And I probably don't have
That's
Figure
good.
it
one
out,
answer
and
for
I'll
you.
pick some little
I probably have
creamy potatoes.
several.
Oh, yum.
You cook your potatoes and you mash them. And if I.
Don't you leave some on the side?
Worth looking at and seeing if there's something we can do, probably,
Okay.
but you definitely have
It's
several
creamy
things
soup,
going on.
like tomato.
that's what I thought.
At least in number 2 and number 3,
Uh-huh.
you may also have a variant
And, butter.
of those as well, since you have some on the front side.
Cheese.
I think I might have put a little cheese in, I can't really remember now, cause the cookies and what I fixed the other night, it was
Correct.
the recipe I'd used the first
Yeah.
time, so, but anyway.
Get in the truck and you go.
Alright. Okay, I don't know what to do.
Okay, we'll call Dr. Kwan's office in the morning,
Okay.
okay? And tell them that you wanna come see Luke for your back.
Okay.
And that they'll either say, okay, we'll send an order over, or they'll say, you have to come see Corey first.
When I get all
I know.
my wiring done.
That's crazy.
I know.
So I'm
And
number
then just
1
give us a
interested
call
to
or
see
just
how
call
that
Alex.
continues to move for you.
Either way, and we'll
Thank
get
you.
all set up.
You're welcome.
Okay.
Number 2,
And
Thank
then,
you. Did a good job tonight.
thank you.
and tell your sister the same thing,
Age
when she
matters,
sees Dr.
age is
Boston.
the only thing that defines what happens here.
Do you need help getting out to your car,
Too
Rose?
many-
Oh, I
too many
know,
people
I know,
are-
I walk now.
Okay.
My kids are trying to tell me I'm too old to do this, too old to do that. And yes, I know, at my age, I should, I'm not as strong as I was, physically. But I've got common sense, and I am careful when I do things.
It doesn't mean you've gotta get in a recliner and stay there
No.
until you die.
No, that ain't gonna be.
There's way too many medical people, doctors, who that's their answer. Well, you're just old. Well, that's bull.
Yeah, it is.
There are things, people can still,
Well, when you just sit down, you die.
yes.
There's- Yeah, and I know this,
Step 1 is that attitude. So you keep that attitude and that.
you know, I did buy a riding mower. Even though I got a small lot. But, it'll take me hours to trim because of that set.
Oh, and that's
That's-
even mine. God, that's terrible.
Yeah, that's just, and I've got to where I try to stand it real different, kinda go along the fence and do it this way, rather than kinda try not to lean to it.
Now,
but-
if a person were gonna use a back brace for doing that, that would be smart, because that's just a bad position.
Well, it's been so bad at times, I could walk up to the kitchen counter and chop up just a bowl of salad for me,
Mhm.
and I'd have to go and sit out, cause I'd be hurting from standing there because of that forward movement.
We moved this from our center of gravity forward, and all of a sudden,
Yeah,
everything changes. All of a sudden, these muscles, if they're not doing their job, then we're relying on the ligaments, the tendons, the disc to do the job, and then bam.
well, feel how hard I am up and down this side.
Now, where are your wires and whatnot at?
Well, they're under a plastic or, bandage type thing, so you're not gonna, see how hard I am up and down that side, you get a sore spot.
So, as we get down here, how are we there?
That's okay. Well, that was a little bit tender. Yeah, that's a tender spot, yeah.
So you're having a little bit, more of the number two problem up here.
Yeah.
A lot of people get more of it down low.
Yeah. Now the sciatic is right in there.
Okay.
Mm.
Probably a
Yeah,
little,
well, I'm gonna- I
number
gotta-
two, number three.
So,
So, do your wires.
yeah.
If it gets terrible, I've worked with people having things going, how long before they,
They're gonna look at them Friday, and I'm not sure whether they're gonna pull them out Friday or not, but this is so neat, cause you know, with the tins here, you got that thing you gotta put in your pocket and your wires are running loose. I worked and I had to wear slacks, so I had a pocket with my shorts hanging out to
Uh-huh.
cover up the wires. But this is underneath there, and this is the way I adjust it.
it's Medtronic.
Oh, wait, this way. Work for me. Yeah, you're fully charged.
Might not be
Wait,
snappy
what's that?
enough. You just press it.
Yep. My therapy. And then this is like for the right side. Yeah, I went up one and I felt it. And then turn to the left. I thought you dropped it too before. Not very good. Begin to feel a little bit. Yeah.
Interesting. Isn't that amazing?
Yeah.
Interesting.
It's got a charger, it's on the floor of the house right now. But, you know, it's all goes back in and, you know, and then pulls them out. But they said the wires are probably about the size of a dental floss. And it, you know, if you wiggle around too much, you can go ahead and pull them out and move,
I'll get those.
tape them, you know. Not supposed to bend, not supposed to twist.
You don't want to undo.
No, not at all.
We'll see you once you learn what's happening there,
Yeah,
and we'll see what we come up with.
and I'll bring you a card from that.
Good, please do, please
Yeah,
do.
cause he works in Fort Worth once, well, actually South Huron once a month, or once a week. But when he does stuff like this, he has to go to the big office over in Arlington, but it's only about 3 blocks off of 20.
Mm.
And he's on Cooper, so it's.
Okay. Well, thanks for coming out.
Please
Yeah, help
do.
yourself.
We've been eating way too much candy, but
Halloween candy, or is that always yours?
No, it's the Halloween candy.
Yeah, just got rid of mine.
Bye.
I'm almost done with my last POV and then I'll help.
Awesome.
Is this still rolling?
Oh, yep. Sorry, completely forgot about that.
How about what?
His video that was recording.